This information is for educational purposes only. Always consult a healthcare provider for personalized medical advice, diagnosis, and treatment. Sexually transmitted diseases, or STDs, are infections that spread through sexual contact. They are a common health concern and can have serious consequences if left untreated. Understanding STDs is crucial for protecting yourself and others. STDs can be caused by various microorganisms, including bacteria, viruses, and parasites. Bacterial STDs, such as chlamydia, gonorrhea, and syphilis, are caused by bacteria. Viruses like HIV, herpes simplex virus, and human papillomavirus cause viral STDs. Parasitic STDs, such as trichomoniasis, are caused by parasites. Engaging in sexual activity carries inherent risks, including the transmission of STDs. The more sexual partners a person has, the higher their risk of contracting an STD. Using condoms consistently and correctly can significantly reduce but not eliminate the risk of STD transmission. HIV, or the human immunodeficiency virus, is a virus that attacks the body's immune system. It does this by destroying CD4 cells, which are white blood cells that help the body fight off infection. Without treatment, HIV can weaken the immune system to the point where it can no longer fight off infections and diseases, a condition known as AIDS, or acquired immunodeficiency syndrome. HIV is primarily transmitted through sexual contact with an infected person. It can also spread through sharing needles or syringes with an infected person. Additionally, HIV can be transmitted from a mother to her child during pregnancy, childbirth, or breastfeeding. Understanding the risk factors associated with HIV is crucial for prevention. Engaging in unprotected sex, sharing needles, and having multiple sexual partners significantly increase the likelihood of contracting the virus. Early detection and treatment are essential for managing HIV and preventing its progression to AIDS. It's important to note that HIV is no longer the death sentence it once was. With proper medical care and treatment, people with HIV can live long and healthy lives. STDs can manifest as a range of symptoms, but it's important to note that many people with STDs experience no symptoms at all. This is why regular testing is essential, especially if you are sexually active. Common symptoms of STDs can include unusual discharge from the vagina, penis, or anus, pain or burning during urination, sores, blisters, or bumps on or around the genitals, anus, or mouth, pain in the lower abdomen, and fever or flu-like symptoms. HIV symptoms can vary depending on the stage of infection. During the acute stage, which occurs shortly after infection, some people may experience flu-like symptoms such as fever, headache, fatigue, and swollen lymph nodes. However, many people may not experience any symptoms at all during this stage. As HIV progresses, it weakens the immune system, making the body more susceptible to opportunistic infections. These infections can cause a wide range of symptoms, making it difficult to diagnose HIV based on symptoms alone. HIV testing is crucial for diagnosing and managing the infection. The most common type of HIV test is an antibody test, which detects the presence of antibodies to HIV in the blood or saliva. Rapid HIV tests can provide results in as little as 20 minutes. If an antibody test is positive, it is usually followed by a confirmatory test to confirm the diagnosis. Protecting yourself and others. Prevention strategies. Preventing STDs, including HIV, involves a combination of strategies that focus on reducing risk factors and promoting safe sex practices. Condoms act as a barrier, preventing the exchange of bodily fluids during sexual activity. When used consistently and correctly, condoms significantly reduce the risk of STD transmission, including HIV. Vaccination is another effective prevention strategy, particularly for certain viral STDs. Vaccines are available for HPV, which can cause genital warts and cervical cancer. Hepatitis B is another viral STD that can be prevented through vaccination. Vaccines work by stimulating the body's immune system to produce antibodies that protect against specific infections. Education and open communication about sexual health are paramount. Understanding how STDs are transmitted, their symptoms, and prevention methods empowers individuals to make informed decisions about their sexual health. Regular testing is also crucial, especially for those who are sexually active. Early detection and treatment of STDs can prevent complications and reduce the risk of transmission. For HIV prevention, 2 additional strategies, PrEP, pre-exposure prophylaxis, and PEF, post-exposure prophylaxis, are available. PrEP involves taking a daily medication that can significantly reduce the risk of contracting HIV. It is highly effective for individuals at high risk of exposure, such as those with partners who are HIV positive. PrEP, on the other hand, is a short course of medication taken after a potential exposure to HIV. It is most effective when started within 72 hours of exposure and can significantly reduce the risk of infection. Treatment options: bacterial, viral, and HIV. Treatment for STDs depends on the type of infection. Bacterial STDs, such as chlamydia, gonorrhea, and syphilis, are typically treated with antibiotics. Antibiotics work by killing the bacteria that cause the infection. It is essential to take the full course of antibiotics as prescribed, even if symptoms improve before completing the medication. Failure to do so can lead to antibiotic resistance, making the infection more difficult to treat in the future. Viral STDs, such as herpes, HPV, and HIV, cannot be cured, but they can be managed with medications. Antiviral medications can help reduce the frequency and severity of outbreaks for herpes and HPV. For HIV, antiretroviral therapy, or RT, is used to manage the infection and prevent it from progressing to AIDS. ART works by suppressing the replication of HIV in the body. This allows the immune system to recover and regain its ability to fight off infections. ART is highly effective in managing HIV and can help people with HIV live long and healthy lives. It is important to note that ART does not cure HIV, and people on ART must continue taking their medication as prescribed. Parasitic STDs, such as trichomoniasis, are treated with antiparasitic medications. These medications work by killing the parasites that cause the infection. As with bacterial and viral STDs, it is crucial to take the full course of medication as prescribed, even if symptoms improve before completing the treatment. Living with STDs and HIV awareness and support. Living with an STD or HIV can be challenging, both physically and emotionally. Stigma and discrimination can create barriers to seeking testing, treatment, and support. It is essential to remember that STDs are common, and people with STDs deserve compassion and understanding. If you have been diagnosed with an STD, it is crucial to talk to your partner or partners about your diagnosis. This can be a difficult conversation, but it is essential for preventing the spread of infection. Your healthcare provider can provide guidance and support in having these conversations. Numerous resources are available to provide support and information for people living with STDs and HIV. Support groups can offer a safe and confidential space to connect with others who understand what you are going through. Healthcare providers, counselors, and therapists can provide guidance, education, and emotional support. Remember, knowledge is power. By understanding STDs and HIV, practicing safe sex, getting tested regularly, and seeking treatment when needed, we can reduce the impact of these infections and promote sexual health and well-being.